everyone. Thank you for tuning in to A Healthier Me. I am your host, Michelle Wakeham. Joining me today on the show are returning guest, Genteva Home Health, and here to talk about their Safe Strides Balance program is Tatum Sear and Carol Leofonte, and I'd like to welcome to the show. Thank you so much for joining me.
Thank you for having us back.
You're
Absolutely.
welcome. And before we get into their Safe Strides Balance program, I would like to have Carol give us a brief summary as to, just to refresh our memory as to what Genteva Home Health is. So Carol, if you could please fill us in.
Sure, absolutely. So our branch is located in Sanford, Maine, in the renovated mill building. We're a home health agency, and we have RNs, LPNs, which do medication management, wound care. We have physical therapists, occupational therapists, speech therapists, MSW social worker. Also, we have home health aides. So we go into your home and would treat you after you discharge from the hospital or skilled facility. We also can go into assisted livings if someone transitions from home to assisted living, because technically that is still your home.
Right.
So we can go in and treat the patients in their own environment.
Wonderful, thank you. So it's really a wonderful program because I think it helps, gives the patient some confidence to send them, to give them what they need, the tools that they need to be more independent after they've been released. So I think it's a great program that you provide there for these folks. So this Safe Strides Balance program, what is that exactly?
So it's an individualized, evidence-based fall risk reduction program.
Okay.
Which we specialize with a patient that is 65 years or older and homebound.
Okay.
So if a patient has a history of falls, we as a team will go in and look at their diagnoses and see why they may be falling.
Okay.
And then put them on this service.
Okay, wonderful. And reasons that they would be falling, you had mentioned, so I'm assuming there's many reasons why someone falls, and what are some of those factors?
Patients that may have diabetes, Parkinson's disease, had a recent hospitalization, they have weakness, a CVA or a TIA. Trying to think what else.
Like any visual, someone has like visual deficits or a recent surgery, if they're just not getting around as much as they used to before, those things would be clues and risk factors for the patients. If they've already fallen once before, that just places you at a higher risk of falling.
Right.
So, you know, we would look at those risk factors and some of the diagnoses that a patient has, like Carol mentioned, Parkinson's, if anyone has vertigo, dizziness, things like that. Medication changes, if you've had a lot of medication changes, within 2 weeks after a medication change, that's when you're at the highest risk of falling. So we really take a close look at those and kind of really monitor those patients closely to make sure.
It's a good point, because I think with medications, people don't realize that sometimes they can make them dizzy or kind of throw off their equilibrium a little bit, and as a side effect.
Yeah.
You know, so that's
A lot of
that's
medications
important.
have that side effect of dizziness or balance deficit, so
Yes.
it's really helpful to have us in there, not just providing the Safe Strides program, but just us in there to provide the services to kind of keep a closer eye. Especially, we find it is really relieving for the family members of the patients that we're seeing, because they know there's an extra set of eyes in there for them.
Absolutely.
So all in all, it's really helpful.
Great.
And some patients are on 4 and 5 medications, so for our nurse to go in, make sure they're taking the right medication at the right time, and that there isn't going to be any complications with taking multiple medications.
Okay.
It's really a good thing to have us in there.
Yes, most definitely. And how long has Genteva offered this program?
I think it came out in like around 2005, so it's been out 7 or 8 years at this point. And of course, for the Safe Strides Balance program, they have revised it and kind of added and taken things away based on what evidence is out there and what research is out there. So it's not just a willy-nilly program that we've put together. We've had a lot of the clinicians that have researched and have worked with the researchers and have read articles and to find out which balance tests are going to show us the biggest risk factors for the patients and which will show the best outcomes and for the patients. So it's really a good, it's a great program.
It is. It sounds like it, and especially, given, our senior citizens, and especially in the wintertime when it gets icy and things like that. And this program helps with that as well, as far as how to
Absolutely.
Stay safe if you have to go outside and be on icy roads or whatnot.
Exactly. And we give them the tools that they need as they age. So even after we discharge them, we give them some exercise programs and some programs that really hone in on their balance, so that even as they age or something, if they get a cold or, not feeling as well, they can still continue with those exercises to prevent a hospitalization or a fall or things like that. So it's really making sure the patients and the families are educated and are given the tools to continue to succeed after we discharge them, which is really important. Our main focus is to keep people out of the hospital, home as long as possible, and to keep them educated and independent for as long as possible. So that's a lot of what we do as a company and as a branch and as a team. So
excellent. What was the motivation behind creating this program?
A lot of the statistics were showing that patients ages 72 and older were falling, and the the average cost of someone who falls is like $20,000. Wow. So in the year, I think it was 2000, it was $19 billion, and they're projecting in the year 2020 to be about $54 billion for a cost for the healthcare system. So it's significant.
Yes.
So anything that we could do as therapists to try and prevent and educate, I think was maybe their focus on this program.
Yes, and it seems like it's climbing. It's going.
Yes.
It's higher and higher. That's a big number.
1 in 3 patients, I think, at the age of 65 and older, falls.
Fall, and then you're talking hip replacements, broken bones,
Pelvis.
Yes. Oh my goodness.
Wrists, we've seen, arms.
Yeah.
Right, so they fall. They're trying to catch themselves, so
themselves.
they're hurting.
And
their
with
wrist.
the baby boomer population, getting older and aging, that those statistics will be even higher than that.
Wow.
So, and a lot of our focus, especially in the next upcoming months, is fall prevention. So, a lot of the times we see the patients when they come out of the hospital or come out of a rehab facility because of an incident that happened. What we're trying to do is educate the community, educate the facilities, educate physicians' offices that those patients could probably be identified earlier than that, and we can get in to prevent that hospitalization, to prevent the fall.
Yes.
So we're trying to really get people to think about things a little bit differently. It's kind of like when you go and get like your annual physical. It's more like a prevention. It's
like
a
being
preventative.
proactive.
Exactly. Right now, I think our system is very reactive instead of proactive. So they fall, then they react and get something
help.
going. Versus there are many signs that even the physician's offices can look at, or the family members or the patients themselves, to get services in. If it takes someone 15 minutes to get from the door of the physician's office inside, that might be a
red flag.
red flag to say, geez, it's taking this person that long to get in. How are they doing at home? How are they managing?
Right.
Or if your family member is going, geez, they really used to like to come out with me more, but now they're staying at home more. That could be a sign. And I know you kind of weed out, well, maybe it's because they're getting older, but that doesn't necessarily mean they have to stop doing the things they like to do.
Exactly.
So
Even the grocery store, I mean, people need to go grocery shopping, and sometimes it's so challenging. The grocery stores nowadays are so huge.
Yeah.
You know, people, it takes a lot out of them to get around the store, and then when they get home, they need to take a nap for an hour or so just to regain that strength. So that's something that we could work on, helping build up that strength.
That's really great. Now, you talked about signs for doctors or nurses to notice in their patients to see if this is something that they could benefit from. And you'd mentioned taking a while to get from point A to point B. What would be other signs for family members or doctors to notice in a patient to recommend this program for them?
if they have any weakness or they've kind of lost their balance before, or they're having a harder time getting up out of a chair, it's taking them a lot longer to do things. They don't want to do the things they used to do. They might even be more incontinent, so they might be having a harder time making it to the bathroom, and now they're, buying the briefs or the Depends or something like that because they can't quite make it. If they're more shorter breath, if a lot of it's a lot of questions, how you ask the question, even at the physician's office.
Mm-hmm.
If I ask a patient, have you fallen lately? Most of them are going to say no. But if I say, describe to me the last time you fell, I usually get a better response.
Okay.
Well, I didn't really fall, but I lost my balance and I kind of hit the doorway or something. So it's how you ask the questions a lot of the time.
Yes.
Even we assess someone's pain every day. Are you having any pain? They'll say no. But if I say, how is your arthritis? How is your back? Are you having any achiness? Oh yeah, it's not pain, but it's achy.
So more
You
specific.
get more specific. You have to really investigate a little bit because they're very proud, and I understand that. And they don't want to admit that something's wrong. They don't want to cause a burden to their family members. They don't want people to get overly anxious. So, it's all in how you ask the questions.
And if people have fallen in the past, they're fearful of falling again, so they may not. You may find that somebody's sleeping in their chair because they don't want to go to bed. That added extra step.
Yeah, to get there.
So it's just, you have to kind of really look at.
So do you find that the folks that have fallen or had an incident where they have gotten hurt, that instills a little bit of an anxiety in them to even want to?
They're not as confident at what they're doing, and if you lack confidence, it's going to affect your mobility and your balance, and it affects everything. So.
Now I know you'd mentioned clinicians. Like, what can clinicians provide this program?
So when we are referred into, see a patient in their home, the clinicians will evaluate the patient and then look at the risk factors that we talked about and some of the diagnoses and figure out if they're appropriate for the program or not. About 90% of the patients that we see are appropriate for the program. So we go in and do our initial evaluation. Then within a couple days, we normally get in and do what's called our Safe Strides Balance assessment.
And that's the physical therapist that initiates that?
Yeah, the physical therapist will go in and initiate that. And so what we look at is the 4 major balance systems that we have. So your balance is made of 4 systems. It's made of your ocular motor or your visual system. It's made of your vestibular system, which is the system inside your inner ear. It's made of your musculoskeletal, so how strong your muscles are, and your somatosensory system, which is how well you can feel. Like feel your feet, feel your legs. A lot of people have numbness and tingling.
Neuropathy.
They have peripheral neuropathy because of diabetes. So we look at, as clinicians, we look at every one of those tests, every one of those systems to figure out which system this individual patient uses more or which system is impaired. So we'll go in and do some strength testing of their legs and figure out how strong they are. Some people have one leg that's stronger than the other. If they've had a broken, like a bone or a replacement of some kind, like a joint replacement, or if they've had a stroke that leaves them with one side, you know, a little bit weaker, then, you know, we can figure that out and focus on getting that stronger.
Okay.
If someone has some peripheral neuropathy, we do what's called Semmes-Weinstein testing, which is very specific. We use like a little, kind of looks like a needle, but it's not a needle, it doesn't go through. It's called a monofilament, and we test certain spots on the bottom of a patient's foot to let us know how much they can feel their feet.
Okay.
Sometimes we can't really change how much they can feel their feet, but we will recommend, you know, proper foot care, proper footwear. So if they can't feel their feet well, we may say you really need to use, you know, make sure you have shoes or socks on when you're walking. The last thing we want our patients to do is get a cut on the bottom of their foot, not feel it, and then have it be infected or have an amputation. And I always say that because it happens, and we see that a lot. Someone will get a toe amputated, a foot amputated,
Oh, wow.
all because they
cut.
couldn't feel a cut on the bottom of their foot.
Wow.
So we do a lot of education on those pieces. Then we will see how much they rely on their vision. And so I will actually do some of those. I'll do a demonstration and show you some of the tests we do.
Okay.
And then we check out their vestibular system. So your vestibular system is kind of what makes people feel motion sickness. So if you ever have like a hard time reading in the car because you get sick,
Would be me.
yeah,
Yes.
or if you go on like a ride, the roller coaster, the things that spin.
Tilt-a-whirl.
Yeah, though that's your vestibular system. So
Okay.
we can figure out if that is impaired and try to give exercises to do that, you know, to get that a little bit stronger. When you're younger, you pretty much use all four systems equally. And as you get older, you start, you know, some people develop diabetes or develop some neuropathy, they get weaker. So then one of those four systems kind of kicks in and does more than the other one.
It's overcompensating
Right.
for what's
so
not
then
being used.
when we go in, we figure out which one they either need to use more, or we can modify their home based on those assessments and say, you know, this is what you need to do right now, you know, rearrange the furniture, or, you know, let's put some tape if your vision isn't as good, let's put some tape on things, color tape, so we can differentiate and decrease your fall risk that way. So
Impressive. It's
yeah.
impressive how much you,
Yeah.
I mean, right down to little details, which is what's needed because in order for them to feel more comfortable and just make it a little bit more easier for them. I mean,
Yeah.
I guess you have to really fine tune everything, but it's amazing. I'm really impressed with what you really,
Yeah.
what you really do.
And the clinicians, before they're allowed to go out and do these, you know, assessments, they have like around 8 hours of computer work that they do beforehand. Then they do a 2-day training on the anatomy of the inner ear, all the balance tests, how to perform them, what it means, why we perform them certain ways. Then they do 5 or 6 labs where we practice all the tests on each other. And then I will go and do like a supervisory visit to make sure their first or second Safe Strides assessments, they have someone there to kind of support them through it. And then I have to do a yearly supervisory visit for them as well. So there's a lot of ongoing education. We receive like quarterly, you know, research articles on different balance things that I send out to the clinicians too, just to kind of keep them updated and on balance and things like that. So it's, the company has really created a great assessment and a great program that has really great outcomes. 95% of our patients will demonstrate a decreased risk in falls.
That's great.
So
It's a great percentage. That's huge. Now, are you going to different facilities and presenting this program, and are they pretty receptive with you coming in and talking to the faculty and staff about?
Absolutely. We do
balance?
some in services for the actual residents or patients at the facilities. And we also do in services with the staff members there, because they're the ones that can advocate for the patients as well. And it's very eye-opening to them once we start showing them what we do and why we do things, and then you can just see their wheels turning. And they'll say, oh my gosh, I know someone that could benefit from this. And that's what it's all about. It's about what the patients need and keeping them independent and in the same place for as long as possible.
Yes,
So, and of course, we always want, we're doing these in services, and of course we want them to come to, to use Genteva as a home health company. But if they choose another company, to me, it's what the patient needs. So whatever they need, and then whatever they need to get better, it's educating, the facilities, the staff, and the patients.
Yes.
And even some family members have come to some of the in-services too. So
Well, there's a lot of family that care
Yeah.
for their parent
Yeah.
or an in-law or whatever it may be, or an
And
ailing
they
family
see
member.
that patient every day, every other day,
Right.
so they know what their routines are, or they know what they can do. So if somebody is not performing like they were, then they can say, oh, wait a minute.
Exactly. Yes. That's wonderful. So it's great. So it's like getting a whole team rooting for this,
Right.
patient to make
Exactly.
sure that their health and everything else is up to par and that they're doing well.
Yep.
That's amazing. It's great.
Yeah. All right, so I'll show you some of the tests that
Yes.
we do.
Yes.
And we do them from anywhere, Carol had mentioned 65, 65 and older. Most of the insurances that we take are we have Medicare Part A, so it's under your Part A benefit.
Okay.
So you don't have any co-pays with that. Whether we come, 2 times a week or 5 times a week, it doesn't matter. It's all under your Med A benefit, so you don't have any copay. We do take some other insurances too. But we have treated patients up to, actually we have the oldest patient in Maine. It's 105 or 106 years old.
Really?
Yes.
She's on the Safe Strides Balance program.
That's
so
wonderful.
it is, anywhere from like 65 to 105 is really who we do the program with. So it's pretty cool. But so when we go in, I use what we call, this is our blue Airex foam. Some patients, it kind of is like a soft surface, and what it does is it stimulates an outside uneven ground. So when you're on the grass or you're on even like a thicker rug, sometimes that can affect somebody's balance. So I have a lot of patients that will say, I'm never going to stand on a piece of blue foam. Why are you bringing this into me? And I said, well, and I explained that's why. So one of the first tests I have them do is I have someone stand up and get their feet all the way together, and then have them put their hands on their belly. So a lot of us, as we age, we tend to like to stand with our feet apart, because that gives us a better base of support, and it's a wider base of support. So, feet, I have them put their feet together. I want to see how they do with a more narrow base of support. So if they can do that for 30 seconds, then they've scored perfectly on this first test. So that kind of just looks at, can they stand like that? And then the second part is I have them close their eyes and stand like that for 30 seconds. So by having them close their eyes, I can figure out how much they rely on their vision to maintain their balance. I have some patients that, again, will say, I'm never going to stand with my eyes closed. Why are you making me do that? Well, when it's a dark room at nighttime, if it's thundering or, it's a cloudy day, it's not as sunny, that affects your vision and how well you see, especially in the patients that have any sort of visual problem anyway. Or if you're in the shower, you close your eyes and you let the soap run off of you, rinse your soap out, your eyes are closed. So I say, I really need to see how you do, because we might want to make different home modifications based on that. So if they can stand like that for 30 seconds, then we move on to the next test. So then I have them stand on the blue foam, So by having them stand on this, I can figure out how much they rely on their sensation in their feet to stand up. Because when I have them stand on this, that takes away that sensation on your feet. So now I want to see what other systems you use your vision more when that's taken away, your muscles, or your vestibular system. So same thing. Stand on the foam, arms crossed, eyes open. And you'd be surprised, like even me, I'm, young and pretty healthy. You can feel yourself kind of going, oh gosh, all over the place. If they can do that, then I'll have them close their eyes 30 seconds. And you can see even me, I'm kind of, ooh, you can feel it. And so now I'm taking away their vision, and they're really relying on their vestibular system at this point and the strength in their legs to maintain their balance. So a lot of people, they stand on this and they can't even keep their eyes open on it for any length of time, because a lot of their systems are going to be impaired. So just by this one test, it's not very strenuous, or you're not going to sweat from doing it, so it's not aggressive or anything like that. It's just stand here, eyes open or closed, feet together, and from there we can tailor their program based on what we find here. Another test that we do is, let me put this over here. We have people stand on one leg, see how well they can do that. That's important because when you go and do the stairs, you're on one leg. Or if you go and get in the shower, you have to be on one leg. You and I probably stand up to get our pants on, put one leg up. As you get older, their balance is impaired, so they tend to sit down. So we notice people start at some point in their lives, they'll start sitting down, and so we do that. We do a lot of, one foot in front of the other. Can someone stand like that? I have patients to test their leg strength. I'll have them sit down on a chair, cross their arms, and have them stand up and sit down without using their arms.
Pushing.
Okay.
Because then you can see how strong their legs are and how much they use their upper body.
Okay.
You'd be surprised how many people can't do that.
Wow.
Stand up without their arms. So just those tests, again, all evidence-based, researched on. They're all directly correlated to fall risk. If you can't do certain tests or you can't perform them in a certain amount of time, it's all directly related to fall risk. So if you can't, stand up and sit down, get your feet together, put one foot in front of the other, there are certain scores that we give if you can or can't do something. And those scores, if you score, 0 to 3, it means you're at the greatest risk of falling. If you score 4 to 6, it means this. And we do a lot of education with the clinicians to say, these are what the scores mean. This is where we'd like to see the patient, because when we get them to this score, it means they're functioning better in their home. It means their risk of falls is decreased. And then with those outcomes, we share the outcomes with the rehab facilities or the physicians. I pass them around to the clinicians to say, this is what you did for this patient. They scored this at the beginning, now they're scoring this. And they love it. And the patients love it.
Yes.
And it's great feedback because they do such hard work, and the patients do such hard work. And it's nice to see the turnaround. I know the facilities and the clinicians in the facilities really like it, because after they discharge, it's kind of like, oh, wonder what happened to them. How are they doing now?
Right. Which is a good thing,
Yeah.
because they're not back,
Yeah.
so it's a good
Exactly,
thing.
exactly. So, the program, and there's other pieces to the program too, but that's just like a little snapshot of kind of what we do, what we look at, and why it's so important.
Yes.
I know other companies do have some other balance programs. I just know ours and ours is very research-based. The outcomes are great, and it works, you know. Every clinician gets, even the occupational therapists get, you know, a piece of blue foam, and we do a lot of work on that. We might have a patient stand on that to empty their dishwasher, stand on that to fold their laundry, stand on it to brush their teeth. So we can incorporate anything, because I know if someone can stand on this, that's kind of like an uneven surface, and they can do it well, then they can stand on the ground, which is a nice firm surface, and that's going to be very easy for them.
Right.
So we challenge them on this every day, and it makes their daily life a little bit easier. So
It's amazing how much you can tell just by them standing on that, because they're pretty simple exercises that you have them do, but yet it tells you so much. Because for me, I know I'd be a little wobbly on that, especially closing my eyes, because I feel it, you know, in the shower, you know, you just feel kind of like you're wobbling. So I can just imagine. I mean, that's great that you have that tool to help you figure out where they're compromised. And once you find that out, like, what are some of the things that you do in the home to compromise with some of those
so
things?
if I notice that someone is using their vision a little bit more, we make sure that they do have like night lights in the house. We might, like I said, put some tape on the edges of the stairs, or we've even had a clinician put tape like on the edge of the tub, so that they knew that where the tub ended. Because if you don't have great vision, it all looks the same. A tub, think about it, it's all white, so you can't really tell where the threshold is. And if they're using their vision more, that probably means their other systems are a little bit impaired. So we might make sure their legs are as strong as they can be, their arms are as strong as they can be, and really work on your musculoskeletal system to increase that, which will decrease your risk of falls. And we give patients, you know, your home exercise program for your arms and legs, but we also have vestibular exercises, and it really just takes like one degree of head movement to work on your vestibular system. So that's very tiny. I mean, you think of one, I mean, you just go like this, that's probably like 10, you know, degrees of motion. So we have people do a lot of, you know, fixing their gaze on a certain object and then moving their head side to side, just that. So it's not strenuous, it's not going to get your heart beating fast, but just that simple exercise, you know, will help you increase your vestibular system and improve that system.
Strengthening the eyes a
Yeah,
little bit.
your eyes and your inner ear.
Yeah, that makes sense.
So because when your eyes are fixated and you're moving your head back and forth, that's your vestibular system. That's why when you're in the car and you're reading a book, your eyes are there, but the stuff is going on the sides. And that is what we're trying to recreate, to get people to be able to turn their head while they're walking and decrease their risk of falls. A lot of people fall when they're walking or if they go to turn quickly. So just by doing those exercises, and they're not hard, but you just have to do them.
Yeah.
You know, and I found even after doing like a lot of the in-services and doing the training, I used to get car sick, and I still do, but it takes me a lot longer until I feel like, oh gosh. I used to only be able to read for maybe, you know, 5 minutes in the car, and then I'd go, oh gosh, you know, I'd feel like, you know, your belly gets all. And so now after doing these exercises in the in-service, I don't even do them every day, but just doing that, I can read like for half an hour in the car.
Okay.
And then get like, oh, you know, then.
Wow.
So part of it is just increasing the length of time that you can do certain things.
That's great.
Yeah.
That's really great. I have to try that
I
because
know.
I can't even look at anything
Yeah.
in the car. It's
It's hard.
yeah, that's amazing. So I think anything else that you'd like to add to the show today about the program or about Genteva?
I mean, I think, you know, like I said, the program is really to prevent falls if you haven't fallen, or to work on not falling again if you've already fallen. And making sure we reduce the risk factors in a patient's home. Some of them we can't. If it's, they have Parkinson's, they're always going to have Parkinson's, but we can work on the other risk factors in the home. And it's really just about prevention, being proactive instead of reactive, and getting patients seen in their homes if they're homebound, to prevent a hospitalization, to prevent a fall. That's really one of our biggest messages. September is actually Fall Prevention Awareness Month, so we're doing a lot of in-services. We have a list of facilities that we're going to be, providing some in-services and fall screens just to see if someone's at risk for falls. And we can't interpret the data if they're not on our services, but we can at least, let them present that information to their physician and say, hey, I think I might need some therapy at home, or even outpatient therapy, or whatever the patients need. The point is just to get it and to be proactive and really. So we'll be doing a lot of those in services and
Wonderful.
For the month of September. So that'll be
Just in time for the holidays, people can stay home.
Yeah,
Yes.
that's right.
Absolutely.
If anyone does have questions, though, they can reach out to us in our Sanford office.
Okay.
They can go on our website, the www.genteva.com. Certainly would be happy to answer any questions that people do have about the program.
Wonderful. Well, thank you both so very, very much.
Yes,
I
thank you for
appreciate you
having
coming
us
back,
again.
and I look forward to having you back in the future.
Okay.
And thanks again.
Thank you.
And to everyone at home, thank you so much for watching. I hope you've learned a lot in today's show. I know I did. It's a wonderful program that Genteva offers, and if you know of anyone, I think we all do know at least one person that could really benefit from this program. You should really check it out at their website. It will be up on the screen at the end of the show, and if you are interested in getting in touch with Carol or Tatum, their information will be at the end of the show. And I appreciate you watching. Thank you so much. See you next time.